right now it gives me tremendous pleasure. So I always say, oh, she or he is my favorite doctor. And that's difficult when they're all in the same room. But Dr. Carol Langford really is one of my truly favorite doctors in the whole world. She is the director of the Cleveland Clinic Center for Vasculitis Care and Research. I've known her, well, we didn't have gray hair back then when we started, so that's about 20 years, I think. But anyway, I'm going to just give a really short introduction. Dr. Langford sees many, many of our patients. She's an excellent researcher. She focuses on ANCA-associated vasculitis, on GCA. She's brilliant. She's known around the world for her, not only for her research, but also for her attention to clinical care. Her patients love her. And so I told her I have to run out and solve a fire. So I'm going to, Dr. Langford, please join us.
So good morning, everyone. So I'm delighted to be here today with all of you. And what I've been asked to discuss with you today is about the connection between vasculitis treatment and your immune system. So how are vasculitis treatment and the immune system linked? This is really going to be the focus as far as what we discussed today. And also, what are the strategies that you and your doctor can use to address the effects of vasculitis medications on the immune system? Now, other than dating myself by making reference to a 1967 Western starring Clint Eastwood, many of you wondered as far as why on earth is the title of this talk, The Good, the Bad, and the Encouraging. And I hope by the end of this discussion you'll have a better idea of that. So let's first discuss by talking about the immune system. So let's start with one of our first questions. And again, as was mentioned, we're going to try and pilot as far as to go through some of the questions, and you have colored paper in your binders as far as if you'd like to participate. So one of the things in trying to frame this as far as is, what does the immune system actually do? Does it circulate the blood? Does it tell our body what is us and what is not us? Does it digest our food, or does it help us think and move? So what do you all think? All right, I'm seeing a lot of B's. Indeed. All right, so it does not circulate our blood. Now, interestingly, there actually is a form of sort of immune circulation, if you will, which is called lymph. But this is different from blood. It also doesn't digest our food, but there is an important link between the immune system and the gastrointestinal tract. And similarly, there is no there is no influence as far as with the neurologic system, but again, there are important links between the neurological system and the immune system. So the immune system really tells us what is us and what is not us. So the real job of our immune system is to protect our tissues and organs by recognizing elements that are foreign to our body. So if we think about this, we have us and our blood vessels, and then other things that are not us, such as infections or potentially newly developing cancer cells. And so what the immune system will do is it will recognize us and hopefully leave us alone, but when it sees something that is not us, it will take steps to remove that from our body so it can't cause us any harm. So next question, what actually makes up our immune system? Is it cells? Is it proteins? Is it different organs? Or is it all of these? So the immune system involves all of these. So there are a variety of different cells that are involved. There are different proteins, both small and large. And there are also organs that are important as far as to our immune system function. So all of these play an important role. So in thinking about organs, again, immune system is located all over our body, but there are certain places where these do tend to cluster. And one of the challenges we have as far as is, although we can get some reflection of our immune system when we do things like blood tests, this is not where most of them live. And so some of these are common places you'll be familiar with as far as things like the tonsils, bone marrow, lymph nodes, which are present all over our body, and spleen. and amongst many others. So these all play an important role as far as surveillance for our body's immune system. There are also more microscopic elements of the immune system, and as I mentioned, this includes a variety of different types of cells and different types of proteins. Now, this schematic, I think, is helpful as far as helping me to think about what are some of the key players that are involved. But I don't want to mislead you as far as thinking that this is really how simple it is. So this is a slide that just demonstrates one pathway that's involved as far as in one of our cells called the T cells. And this is why the immune system is so complex and why there are so many things that we still are continuing to learn. And it is really by the virtue as far as so many of the talented scientists that are at the laboratory helping us to understand these things that we're really making a dent in understanding some of these elements involved in the immune system. So how does the immune system work and how does it go about protecting us? So let's use an example of an infected cut. So if we think about this, once we have a cut, we have the option and the opportunity for bacteria to gain access to our body. And when it enters the cut, it will set up an inflammatory response, and that's something we recognize by seeing redness, swelling, pain, heat, and those are all some of the very earliest features of inflammation that are actually first recognized by doctors even in historical times. When this inflammation is present, it sets off a pathway and it draws inflammatory cells, in particular one called the neutrophil, to the site of the inflammation. The neutrophil will recognize the bacteria, it will engulf it and destroy that bacteria so it can't cause us harm. When this occurs, the inflammation will then resolve, the infection is treated, and the neutrophil moves on and does its business. So inflammation is regulated by our immune system, and in the right setting, inflammation can actually be very beneficial. The key term here, though, is in the right setting. So what happens when inflammation occurs in the wrong setting? And so if we again come back to the concept as far as the immune system recognizing us, what happens when it doesn't, when it gets confused and it actually starts to cause inflammation of its own tissues? And this is a process that we term autoimmunity. Auto meaning self and immunity meaning the immune system. And this is where organ and tissue injury is occurring from our own immune systems. If we take this the next step further, we recognize that there are specific autoimmune diseases in which the immune system is actually causing inflammation within the body's own tissue and organs, causing injury. To date, there are over 100 recognized autoimmune diseases and seemingly growing all the time as we understand more about the immune system. And these are unique and generally treated differently between each other. This is just a small list of some of the autoimmune diseases that you may recognize in terms of things like rheumatoid arthritis, type 1 diabetes in children, Crohn's disease, and then of course, vasculitis is on the list and is considered to be an autoimmune disease. So how do we know this? And we know this in many ways as far as from some of our most fundamental information about vasculitis, which is what we see when we look under the microscope. So if we look at this schematic as far as a blood vessel represented, here's a tube with our red blood cells in the middle, and the pink ovals represent the cells themselves. We can see when we look under the microscope, this is a healthy artery, which we can see, again, a similar representation. But what happens when there's inflammation is that inflammatory cells will get into the vessel wall, and this is what we see in the setting of vasculitis. So you can similarly see here these inflammatory cells both within and around the blood vessel. So another question, prednisone, cytoxan, methotrexate, and rituximab are medications used to treat vasculitis. What do they all have in common? Are they all relatives of natural body hormones? Were they all discovered in Minnesota? Do they all impact the immune system? Or are they all considered biologic medications? All right, so indeed, they impact the immune system. So they're not all relatives of a hormone, but prednisone is. It's a relative of the hormone cortisol. And in mentioning Minnesota, I not only wanted to recognize our hosting state, but also recognize that prednisone or cortisone was actually discovered just down the road in Rochester, Minnesota at the Mayo Clinic. And they are not all considered biologic medications. Rituximab is, but a little more about this in just a minute. But the key thing is that they all impact the immune system. So that then brings us to this concept of the good, the bad, and the encouraging. So first, what's the good? And indeed, there are effective medications for vasculitis, and these work through mechanisms that impact the immune system. So if we think about this in terms of vasculitis, again, this is an inflammation of the blood vessel that is brought about and regulated by our immune system. So when we introduce a treatment for the vasculitis, it will knock out the immune system and then affect those downstream effects, controlling and treating the vasculitis. So what then is the bad? And vasculitis therefore act by suppressing the immune system and halting the inflammation in the blood vessel and tissue. But based upon these actions, these medications are called immunosuppressive medications. And the person who received these then is considered to be immunosuppressed or to have a suppressed immune system. So why is this a concern? So again, if we think about this schematic as far as the good affecting the vasculitis, we also recall earlier that we discussed that the immune system also does important things as far as fighting off things that are foreign to us, infections and cancer cells. So that when we affect the immune system by treating the vasculitis, we also potentially affect those other beneficial effects, in turn allowing these factors such as infections and cancer cells to become more of a concern. So suppressing the immune system is helpful to treat vasculitis, but it also impacts other good parts of the immune system. So why does that happen? So if we think about our schematic again about the conventional immunosuppressive medications, all of these will have very broad effects on the immune system. Cells, proteins, all of these can potentially be affected. And when this occurs, it impacts the ability to perform other immune functions. The encouraging, though, is that there are newer treatments that affect the immune system more specifically. And very importantly is that there are strategies that we can use to lessen the risks of having a suppressed immune system. So let's talk a little bit about those treatments. So in the late 1990s, we began to see the introduction and development of what occurred or are referred to as biologic agents. So the definition of a biologic agent is actually a product that is produced from living organisms or that contain component of living organisms. And again, put more simply, this means they're produced in cells or they contain proteins either from people or from animals. So how do these treatments work? Well, they're considered to be more targeted. So they are affecting specific components of our immune system. So this may be a medicine that affects the T cell, the B cell, our cytokine proteins, our complements, or our small molecules. So if we come back then to the T cell, we can see that when this is affected, all of the other cells are in place, and hopefully this specific targeting allows the other protective elements to do their business and remain in place to protect our host immune system. So biologic agents are being used and are being studied in vasculitis, and there are to date 3 FDA-approved biologic agents for a form of vasculitis. This includes rituximab for GPA and MPA, Actemra or tocilizumab in giant cell arteritis, and Nucala or mepolizumab in EGPA. And there are a variety of other biologic agents that are currently under study. You heard yesterday Dr. Gordon mention about the website called clinicaltrials.gov. This is where I generated this list, and again, this is where you can find out more information about studies that are going on with newer medications in vasculitis. So biologic agents are valuable options in certain forms of vasculitis. This raises some questions. Does this mean that you should be receiving a biologic medication? And the answer is no, not necessarily. Biologic medications are not used for every form of vasculitis, and there are still many settings where conventional immunosuppressive medications and are used and actually remain the best choice for treatment of that individual. The other question is, well, are biologics then truly safer than conventional medications? And of course we do hope so, but the answer is also not necessarily. Every medication we recognize has side effects, and although biologics are more specific for the immune system, they will still affect it. So the overall balance of risk and benefit must continue to be weighed individually. So your doctor will work with you in deciding whether a biologic medication should be considered based upon the type of vasculitis you have, how severe it is, and what the studies have shown. So the other encouraging aspect is that there are strategies that we can use to lessen the risks of having a suppressed immune system. Well, one of the questions I get frequently is, can we boost our immune system, and is it safe? And the question is, that's unclear. Now, you're going to be hearing later today, as far as from Dr. Pendergraph and Dr. Clark, as far as some of the things that are ongoing about our understanding and research as far as these concepts. And again, the question about immune boosters is important to everyone. And also the question is, well, you're telling me the immune system is almost overactive. Is that a good thing to do? So I think there are a lot of areas of research that we have to understand more about this. But there are some things we do know and that we can do. We can use strategies to lessen exposures to infection. We can employ techniques that can prevent certain infections, and we can report symptoms of infection to your doctor and keep on top of recommended monitoring. So it is a fact of human life that we touch things all the time. We need to and we should. And these are things we encounter every day in terms of doorknobs, shopping carts, elevator buttons, and if you work in a common workplace, keyboards. There are also things we need to touch for our safety, such as handrails when we're going up downstairs. And there are things, of course, we want to touch, the things that we love. So what can we do? Hand hygiene. So one of the things as far as get in the habit, wash your hands frequently, keep hand sanitizer close by, and carry a pocket-sized hand sanitizer. We need to touch things. It's not something we want to avoid, but there are ways we can help to protect ourselves. There are also monitoring strategies that can be effective. We already introduced as far as the neutrophil, which is a white blood cell that's critical to fighting off infection. And when the neutrophil level is too low, people are at risk of serious infections. And most medications, potentially with the exception of prednisone, have the potential to lower the neutrophil count. So monitoring of your blood counts by blood tests can help detect if levels are going lower so that medication adjustments can be made and lessen your risk of infection. There's also a question you raised on the list as far as what about our protective proteins, which are called the immunoglobulins. These can be decreased by certain medications. Now, this has been brought more to our attention in the age of rituximab, but by no means is this the only medication that can do this. Our other immunosuppressive medications can also affect our immunoglobulin levels. These can be checked and monitored in certain instances. So talk to your doctor about what sort of laboratory monitoring you should have that will help to protect you against infection. Another question is, should antibiotics be routinely given to prevent infection even if you're feeling fine? The answer is yes, but only in certain instances, because we don't just want to use antibiotics broadly because of the concern for developing resistant bacteria. But there are certain settings. Now, one would be if you had an exposure, as far as, again, a close household exposure to certain proven infections. And one of the ones particularly to keep in mind, which is common, is influenza A or B. Now, by this I mean as far as the true influenza. Many of us will say, well, I had the flu. This refers to the actual viral infection, which can be tested for using a swab. So if your close contact was proven to have influenza, this is something you would want to let your doctor know about because we can institute a protective antiviral. The other one that you've heard quite a bit about is prevention of a type of infection called pneumocystis, which can cause a potentially serious lung infection. This infection only occurs when the immune system is very suppressed. Protective treatment is often given to people treated for vasculitis, and there are a variety of different options. Another issue is vaccinations. So vaccinations or immunizations can stimulate a protective response against a specific infection. So these raise a number of questions. Well, are vaccinations safe? And the answer is yes. Vaccines may carry rare risks, but when we think about this, the risks of the disease they prevent are greater than the vaccine risks themselves. And again, unfortunately, in the news we hear every year about fatalities occurring from something very common, such as influenza, that we do have vaccines for. Another question is, well, will these work if I'm on immune suppressive medications? And we do know that some immunosuppressive medications, and again, this is something we've learned particularly from the rituximab story, may impact the ability to make a protective response. However, this doesn't mean that we shouldn't try and these should not be given. Another question would be, well, can I take any vaccine if I'm on a vasculitis medication? And the answer to this is no. There are different types of vaccines, and we tend to separate this in terms of what's called a live vaccine, which means it contains the actual virus. These should be avoided. And also there are non-live vaccines, which are the majority of what we have, that have no infectious potential, and these can be given. So non-live vaccines are important and are beneficial, and some of the more common ones that you should be aware of as far as, again, the annual once-a-year influenza A vaccine. There's a pneumonia vaccine for a particular type of pneumonia called pneumococcus, and there are two of these called the Pneumovax and the Prevnar 13. For younger people in college age, as far as HPV and meningitis vaccines, hepatitis B, and then tetanus. Again, we're very common if we get a cut, we go to the emergency room and have a tetanus vaccine, and these are often combined with other vaccines as well. Now, the live vaccines that need to be avoided, the major one that's been in the news more recently is MMR, or measles, mumps, and rubella. And again, measles, we have seen some outbreaks in certain areas related to reduction in vaccination. The concern with this as far as, well, should I get a measles booster? This is live. So again, this is something that generally needs to be avoided. The other one, as far as for people doing foreign travel, is for yellow fever. And there are also questions about the shingles vaccine, and there are two of them. The older one is called Zostavax. This is a live vaccine, and again, generally needs to be avoided in a number of settings. And the newer one is called Shingrix, which is not live. Again, it's been available for about 18 months now. And again, there are individual discussions you would have with your doctor about if they feel there's enough information with this for you to receive. So again, always check with your doctor as far as if someone suggests a vaccination, you just want to make sure that this is not live and that it's safe for you to have. And if it is, that's a good thing. What about other issues with infections? So if someone else has an infection, again, where possible, have ill loved ones, hold off from visiting if they know that they're sick at that time. And again, let your doctor know if you've been exposed to a named infection, again, influenza, meningitis. If you think you have an infection, let your doctor know about it. Let them know about the symptoms you're having and try to avoid it, well, let's wait and see approach. The other thing I always tell people as far as things you might not have thought twice about in the past, a fever, a cut that looks kind of red and nasty, a bad cough where you're bringing up yucky stuff, those are things you want to let your doctor know about. So speak to your doctor about infection prevention as well as symptoms to watch out for and what you should do if those start to occur. Now, the other thing I mentioned in terms of what the immune system does is surveying for abnormal cells or potentially pre-cancer cells. And there are many preventable or early detectable cancers. We're familiar with colon cancer screening over the age of 50 or younger if you have a family history. For women, mammography and gynecologic health, and for men, prostate and testicular health. Well, what about skin cancer? And it's particularly important to be sun aware and sun smart. So some of the medications we use for vasculitis can increase the risk of sunburn or even increase the risk of skin cancers. So use sunscreen or cream that contains an SPF, wear hats to protect your face, and it's a good idea to have a once-a-year skin check by a dermatologist. So there's a lot to think about when you have vasculitis, but I always tell people as far as don't neglect what I would consider your every person healthcare screening. Again, things that are important to everyone. So in summary, the immune system and inflammation play a major role in vasculitis. And we talk a lot about inflammation, again, being a bad thing. But I think, as I hope you've seen, as far as this is also something that can be our friend and can be important. And these are important contributors in protecting our health. So vasculitis is treatable through actions on the immune system, but the challenge we know is that suppressing that immune system can have certain negative impacts. The very positive thing I hope you leave with today is that there are strategies that we can employ that can lessen those risks. In terms of take-home messages and action items for you to think about and talk to your doctor about, speak to them about how your medications impact your risk for events related to suppression of your immune system, and discuss strategies that you can use to lessen those risks. It's very likely you're already doing all or many of these, but it's always a good idea to reflect back and see, are there other things that we can be doing together to improve your risk as far as suppression of your immune system. So with that, I'm going to close and open to questions for you to bring up on your cards. So thank you very much. All right, so one question here is as far as, does the immune system often attack cancer that just never develops and that we never know about? Well, that's the thought as far as, again, that our cells are turning over all the time. So again, we know about that as far as, even if we take an example of the skin, we know that we shed skin cells. Our bodies are constantly turning over new cells. And as the process of those cells duplicating, every once in a while, a little error will occur in that cell, and it has the potential to develop into a cancer cell. That's what the body and the immune system recognize and removes from our body before it can go ahead and do that. So it may be a pre-cancer cell that's occurring, and that's, again, the hope and the goal. And those are things that are going on all the time that, yes, that we never know about, and that's a good thing. All right, so this is a question as far as, given the fact that, again, immune responses occur in vasculitis, if there is a relapse, will it be the same, milder, or more intense, and will the symptoms be the same? So, you know, this is something as far as I always discuss with people, that relapses can be unpredictable. You know, the hope is that, again, recognizing once someone has a diagnosis, that we will know as far as what to be alerted to and be able to detect potentially at an early point. What happens is also very individual. For some people, they may relapse in the same way every time, or it may be something different. And that's why, similar to what we talked about with infection, if you have a new symptom, something that just doesn't seem right, let your doctor know about it so that you can look into this together to see if this is anything to be concerned about or not. All right, so one question here is, far as discuss how the immune system affects the gastrointestinal system. And that was one of the things I sort of hinted at in one of the questions. The gastrointestinal system is one of the major places that we interact with our environment. And all along the gastrointestinal symptoms, there are immune rests. As far as some of these are called Peyer's patches, which contain immune cells. And there are also multiple lymph nodes that are all along the course of the gastrointestinal system. So the GI tract is constantly alerted to what's entering our body and is keeping an eye on this. Now, this is an area of intense interest right now, and we're going to be hearing a little later today about the microbiome. And this is an area, again, that has raised a lot of questions because, again, the gut has a particularly important microbiome that may play a role. So this is an area we're just continuing to explore, and we do recognize that there is an important relationship that we are yet to fully understand. So does a poor immune system or poor health lead to vasculitis? And that's an excellent question. I mean, I think one of the theories that all of us scientists, people with vasculitis, share similarly is what starts this all off, as far as what is it that leads to what we saw on the slide as far as our bodies all of a sudden not recognizing what is us. And we don't fully understand that, again, as far as what are the leading factors that then go into this. So we don't understand that fully, and we know, again, that the immune system has something that goes wrong with it that initiates the inflammatory response. But as far as saying what the trigger is right now, that's under investigation. So would you recommend getting a flu vaccine more than once per season if it's a bad season? So this is also an area there's been interest in. There are several different types of flu vaccinations. For people over 65, there is what is considered a higher potency vaccination. That's in a sense as far as potentially as far as almost double as far as what the vaccine is. And there have been some thoughts as far as whether it may be helpful to do that. So again, that's something to discuss with your doctor about. Flu vaccines usually become available in most communities somewhere between September and October. And again, it takes some time, as far as roughly about a month, for the protective response to take place. All right, so let's see. This one is recommendations are now for women over 70 to not have some cancer screenings, such as pap smears and mammograms. Does this apply to vasculitis patients? 70 is still young in my book. Getting more so every year. So again, I would say that's something individually to discuss with your doctor about. I would have said that that was still a bit young to stop some of those screenings, and particularly in vasculitis, I think there's additional reasons to do that. Because again, these are treatable problems as far as if a nodule is detected in the breast or there's some cells as far as in the cervix, then that can be addressed before they cause a problem. Yes, there becomes a certain age as far as where some of that screening becomes not necessary. At 70 seems a little young. All right, so we've got a couple of questions about this as far as if a family member has a live vaccine, is that a concern? And this is actually a very interesting question that a number of us have thought about. When a person has a live vaccine, there is some shedding of that occurs for a period of time. We have not seen as far as that there has been a clear indication as far as with this. Now, the one scenario that we don't encounter really anymore as far as there was at one point oral polio that was used. This is not used in the United States anymore. That was shed through the gastrointestinal tract. So again, I think it's something to be aware of as far as talking with your doctor about as far as a family member, but we haven't seen a clear signal as far as today. But again, I think it is something that we are aware of and have some concerns about. All right, so this is a question about risk assessment and traveling to different countries. So the things I tell people as far as about travel and infection risk are what is the country one is traveling to. So there are different organisms that may be different risks in different countries. So again, Europe, Canada, there are certain places that again have things that are very similar to what we do. Other parts as far as Africa, Asia, there are more risks as far as different types of organisms. And some of those, again, we can find further information about on the Centers for Disease Control or CDC website. Now, the other issue with travel that I often mention with people as far as is, in the hopefully very unlikely event that you got ill, is that an area that is going to be familiar with vasculitis as far as being able to take care of you? And again, Europe and Canada, there are many, many excellent vasculitis physicians. In other parts of the world, they will be less familiar with this. So again, if you're going to take certain travel, you want to just talk to your doctor about it as far as where you're planning to travel. And also, again, there may be certain vaccinations that are recommended for certain countries. You want to make sure that those are going to be safe for you to receive. All right, so once you've reached remission, does your immune system return to normal, or are you still considered autoimmune? So the fact that, again, for the most part, that these are relapsing diseases suggests that there is some change that takes place in the immune system as far as that still raises the potential for autoimmunity. So again, I do consider, as far as if someone has had a diagnosis of vasculitis, that they should continue to consider that this would remain a potential moving forwards. So there are instances where, again, we don't see relapses occur. Does that mean that the immune system is no longer displaying an autoimmune pattern? That's not entirely clear. And again, I think as we understand more about the immune system and potentially have the ability to be able to probe some of those questions, we may be able to understand that better. There's a question as far as about immunoglobulin replacement. So I mentioned on one of the slides about immunoglobulins, which are our protective proteins. Now, one of the ways as far as that you can also think about, well, what are these? So when you do actually a vaccination, what your body does, it's making a protective response. And what that is the manufacture as far as of these immunoglobulins. When your levels are low, as they can be, again, from certain medications, this raises the potential as far as risk of infections. Now, there is a way to be able to replace these immunoglobulins, and this is through immunoglobulin replacement, which can be done by vein, which is called IVIG, or it can also be done under the skin. Again, there are risks and benefits to doing this, and we weigh that individually in that individual. Recently, there have been some shortages as far as of this, and again, how this is manufactured is it is a blood product. So when people donate blood, the blood is separated into many, many different components. So there can be red blood cells for people who have a transfusion. There can be the clotting cells, platelets, there can be plasma, and one fraction is these immunoglobulins are removed. So this is taken from hundreds or thousands of individuals, so all of their collective protective response is put together, and this is what immunoglobulin replacement is. Now, as over time we have gone historically through shortages as far as where it is up and down with this. And often people have had to potentially switch product during that period of time. We are in such a period right now, and I have a number of people who have told me they've been having difficulty getting their immunoglobulin replacement. I've not heard anything as far as where we are as far as that being reversed, but most of the time when this has happened, there has been, again, an upswing where that's no longer a problem. So during that period, again, typically people will need to change product to continue to receive their medication. All right, well, so this is about hand sanitizer, and also the fact as far as that use of such substance as far as is a contributor to the emergence of antibiotic resistance. So I agree there is a balance here as far as, again, how to be able to view this. I think the major thing, again, would be for someone who does have suppressed immune system as far as using the hand sanitizer right after as far as to be able to minimize that response. So I think, again, there are certain things that we've been looking at as far as the incorporation of antibacterials into our everyday products as far as dish liquid and detergents and things of that sort. I think that doesn't necessarily apply as far as to hand washing and hand sanitizer in people who have suppressed immune system. So this is a question as far as are patients at increased risk right after rituximab treatment? And does rituximab decrease the benefit of taking an antibiotic? So as far as increased risk, again, I'm going to read that as far as increased risk of infection. So there's a lot of things that go into the profile as far as what's going on around the time of rituximab. So one part would be, well, are you receiving rituximab for active vasculitis, in which case you're probably on higher prednisone as well, which is probably one of the main culprits in terms of infection risk. The other thing as far as when one gets rituximab is that they will get pre-medication as far as with prednisone or what's called solumedrol to reduce the risk of an infusion reaction, and that will also play a role. So there is probably some increased risk during that period immediately after rituximab. Again, what that will do is it will decrease the immune cells, the B cells, And again, it will do that for a period of time. Now, will it decrease as far as if you actually have an infection and you need an antibiotic for that? No. So the antibiotic will still work as far as if it's directed towards the correct organism or group of organisms. It will still work just the same regardless as far as what immunosuppressive medication you've received, including rituximab. We were talking about blood products, and someone asked, should you avoid donating blood due to disease? So I would say as far as the disease itself is less of a concern. I do generally advise people, it's very generous for you to want to be able to donate blood to help other people, but it's okay to be selfish in this instance. And I actually think it's a good idea. You never know what's going to happen, just to kind of, keep your blood as far as for yourself right at that instance, as far as to help make sure that you have sufficient as far as for anything your immune system needs to do. So again, I think in general, it's a very generous and kind thing to do, but in this instance, I think there are other ways you can also help people as well. So one of the questions as far as how does potentially layering or having multiple immune medications affect the immune system? And will that make a difference in terms of risk? And the answer is yes, and that's always something that doctors will take into account as far as when they are recommending to you what medications to consider, is how those will affect the individual parts of the immune system. So prednisone, again, which is a foundation for many, many types of vasculitis, will have some of the broadest effects on the immune system. Rituximab, which has been discussed for some people, as far as, again, that will affect the B cell, but it does so for a prolonged period of time. So even if you receive rituximab today, those effects will be around for 6 to 12 months or potentially even longer. So that's a thing we also have to factor in. And there are instances that there will also be other medications that suppress the immune system that are used as well. Methotrexate, azathioprine or Imuran, Cellcept. So each of those will play some role. And if you use more than one, yes, it will impact the immune system more. There may still be reasons as far as why those combinations of medicine are felt to be best for you, and that would be something your doctor would discuss. But we always do so recognizing that it may potentially have more impacts on the immune system. All right, so we also talked about blood and cardiovascular, and does having vasculitis increase your risk of cardiovascular disease? And so again, that would be things as far as cholesterol, atherosclerosis is another term. One of the interesting things that we have observed for those of us who work in rheumatology is that many of our inflammatory diseases, rheumatoid arthritis, lupus, increased risk of cardiovascular disease is a concern. And there have been some studies that have similarly suggested that there is an increased risk in people with vasculitis. So I do think this is something that's important to, again, have a proactive approach to, as far as making sure this is a blood vessel problem, that we're doing everything proactively to be able to impact our blood vessels in a good way. So reversing those things that are potentially reversible, so knowing your cholesterol, making sure that's controlled, blood pressure, blood sugar. Again, we don't have any control over our family history, but those things that are reversible. And yes, I do think some of those should be more strict as far as in people with vasculitis than in the general community. So there's a question as far as about longer term use as far as with vasculitis medications and the immune system. And that could be true as far as with our conventional medications, Imuran, methotrexate, Cellcept, or rituximab. And again, there have been ongoing studies as far as about the role of these, again, particularly rituximab, as far as using repeated infusions. Now, we all recognize that, again, the longer we use a medication, and as long as we're on a medication, there will be impacts on the immune system. And this has to be balanced as far as against the potential for relapse and what that might mean for this individual versus the risks as far as suppressing the immune system. And this is something that is individually based. Again, our concern as far as with longer term use of rituximab as far as is over time, could we potentially see a reduction in those immunoglobulin proteins I mentioned? And again, this is very individual. There have been some studies that suggested this is particularly the case in people who have previously received other medications, things like Cytoxan, methotrexate, Imuran, where again using rituximab in that setting as far as all of these things impacting this. But again, I think it has to be a balance as far as, again, our concern about trying to protect the individual from relapse, which again, if that occurs, it's not something we want to have in terms of potentially injuring organs, the need for prednisone, which we all want to avoid, versus how do we impact the immune system. So these are, again, individually based decisions, and that would be something, again, to discuss with your doctor about where should that balance be for you. So with that, I'm going to close, and again, thank you all so much. I'll be around for any questions.